Good afternoon. Today is Friday, February 23rd, 2024. I'm Donna Will, Professional Development Coordinator for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to the DDA Waiver Application Process Training. On the panel today, we have Rhonda Workman, Director of Federal Programs, and Linda Yale, Deputy Director, Western Regional Office. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone. If you look at the panel interface on your right labeled audio, you can click either computer or phone to switch for the best option. There is one handout for the webinar, and that can be downloaded from the handout section, or if you are listening by phone, you can request that it be emailed. We will be recording the webinar and posting this session on YouTube and the DDA website. Today's PowerPoint has been uploaded as an attachment and is available for you to download in the webinar panel box. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Rhonda Workman, Director of Federal Programs. Good afternoon.
Good afternoon, Donna. Thank you so much. Can you go to the next slide, please? On behalf of the entire DDA team, we want to welcome you to today's training on the new concurrent waiver application processes. Joining us today are various DDA partners, such as providers and others who are interested in learning about the waiver application process. Our presentation is specifically geared towards coordinators of community services. During our question and answer sessions, we will be addressing CCS questions only. For our other DDA partners, if you have any questions, please follow up with your regional office. Please do not note questions in the chat box. First, it is important to note that we are not changing the DDA waiver application packet components. Today, we will be sharing how the components need to be done concurrently. We collectively support approximately 19,000 individuals and their families in need of home and community-based services to ensure their health and welfare and to support their goals. To further support our collective priority for individuals to be enrolled and access home and community-based services as soon as possible, the DDA-operated Medicaid waiver application processes are aligning with the other Maryland Department of Health Home and Community-Based Service Program application processes. And the new DDA concurrent eligibility processes we are discussing today will support more timely waiver eligibility determinations. The new processes we are sharing today can begin today. We know your agencies may be updating internal processes and procedures and suggest that you connect with your supervisors and managers. However, please note the new processes will be utilized for our upcoming transitioning youth and all other individuals placed on a waive as of March 1st and thereafter. The DDA will be placing our transitioning youth on a waive so that you can begin that waiver application process by or before March 1st. Before reviewing the agenda, I want to ask you for your focused attention to our training today. Please close emails and minimize distractions. Please jot down questions during our presentation. Some of them may be answered in a later slide. If you have questions we have not addressed during our presentation, please note them in the chat. For today's training, our agenda includes a brief review of the waiver eligibility requirements, clarification on the differences between the Medicaid waiver application versus DDA's waiver application packet, as these terms differ. We will start with a high-level overview, think 50,000 level view of the current waiver application processes and the new concurrent waiver application processes. We will also share 10 key concurrent eligibility processes. We will review the DDA waiver application packet and share important reminders for the various packet components. We will also review some scenarios, such as people in crisis or emergency situations, transitioning youth, and individuals leaving institutions. We will also share some guidance related to the state review teams and ABLE accounts. Our last slide includes some tools and resources, and we will end with questions and answers. Next slide, please. First, let's review waiver eligibility requirements. To be eligible for a Medicaid waiver program, the person must meet waiver-specific technical, medical, and financial eligibility criteria. Applicants must demonstrate through a screening process that they need the level of support that people receive in an institution. They need to demonstrate that they meet the waiver financial eligibility requirements, and they have to have a person-centered plan that supports their health and welfare. As a reminder, the DDA determines technical and medical eligibility, and the Eligibility Determination Division, or EDD, determines financial eligibility. All of these steps can be completed at the same time. Next slide, please. Before we begin discussing the new concurrent eligibility process, it is important to distinguish between the Medicaid waiver application and the LTSS Maryland DDA waiver application packet. The Medicaid waiver application is the state application used for all applications applying to a Maryland Home and Community-Based Service Waiver Program. Based on the person's current situation, a long or short form of the long-term care waiver application is completed. The DDA waiver application packet is the LTSS Maryland form that includes an overview section with the waiver application status, the enrollment checklist section that gets filled in when the level of care, person-centered plan, Medicaid waiver application, freedom of choice form, and the EDD release form are completed and uploaded. It also includes a documentation section that includes the medical or the Medicaid waiver application, the freedom of choice form, the EDD release form, meeting minutes and sign-in sheets, and other supporting documents like bank statements, trust, ABLE accounts, information, and others. And it also includes the workflow history section demonstrating the steps in the current state. The concurrent eligibility processes we are discussing today will include processes associated with both of these items, the Medicaid waiver application and the DDA waiver application packet. Next slide, please. This slide is a high-level view of the current waiver application processes. This visual shows the DDA regional office staff processes begin with the placement of the person on an LTSS waive on day one. The CCS can also begin their work on day one by reaching out to the person to set up a meeting and start creating the person-centered plan and DDA waiver application packet. EDD does not begin their work until later in the process. EDD cannot begin their work until the Medicaid waiver application is submitted. Our current process, including last year's transition youth, has the Medicaid waiver application being created and uploaded into the LTSS Maryland system after the PCP processes. This results in EDD receiving the Medicaid waiver application at day 30 or later in the process. For individuals who do not have a federal disability determination, the state review team process is also needed. This process also does not begin until after the Medicaid waiver application is submitted. Next slide, please. This slide is a high-level view of the new concurrent waiver application processes. Similar to the current process, the DDA regional office staff processes begin with the placement of the person on the LTSS wave on day 1. The CCS can begin their work on day 1 after receiving the alert in LTSS. When reaching out to the person to set up a meeting under our new processes, the CCS can begin to share the waiver application process, including financial supporting documentation that will need to be collected. The CCS will prioritize creating and submitting the Medicaid waiver application first. The CCS will also concurrently complete the various LTSS Maryland DDA waiver application packet processes, such as the person-centered plan, level of care, freedom of choice, and EDD release form. We will further review these and other action in today's training. With the Medicaid waiver application being prioritized and submitted as soon as possible, EDD can now begin their work on day 3. By submitting that Medicaid waiver application first, EDD can begin to review financial documents and systems to determine the level of assets, incomes, and medical expenses the applicant has. For individuals who must go through the state review team process, this can also begin as soon as possible. Next slide, please. This slide is a high-level visual of the old process and the new concurrent processes. It demonstrates EDD being able to start their work as soon as possible and support more timely eligibility determination and access to services. Again, the importance of submitting the Medicaid waiver application, the short or long form, first is the key to this new process. Next slide, please. This slide is a general overview of the key DDA eligibility processes. The first step in the DDA eligibility application and determination, and the last step is the process in the LTSS Maryland overall decision form. DDA regional offices, CCSs, and EDD have specific critical processes to complete. For some steps in the process, one entity, meaning DDA, CCS, and EDD, cannot begin their work until another entity completes a key process. Let's review each process and some important reminders. So the first process on the left side of the screen is the DDA eligibility. In this process, the individual has applied for DDA services and has been deemed DD eligible according to the Maryland statute. The individual is then added to the DDA waiting list. The next key process is waive placement. The individual is placed on the LTSS Maryland waive and provided an opportunity to apply to a DDA Medicaid waiver program based on assessed need. The CCS will get an alert that the individual has been added to a waive. The Medicaid waiver application and person-centered plan program type must match the waive program type. Note, if the individual needs a different waiver program type, CCSs can reach out to the regional office. You'll hear more about this in our upcoming slides. The next key process is the Medicaid waiver application. The Medicaid waiver application, titled Long-Term Care Waiver Medical Assistance, long or short form, is used to apply to a specific DDA Medicaid waiver program. Note again, this is the first step to be completed in our new concurrent processes. This should be submitted within the first 3 days from the date the individual is added to a waive. The next key process is the person-centered plan. The person-centered plan outlines an individual's goals and visions for their good life. A CCS must submit an initial person-centered plan in LTSS for the same DDA Medicaid waiver program that is identified on the MA waiver application. This should be completed within 10 days. The next key process is the authorization of the person-centered plan. Regional office program staff review and authorize the person-centered plan. This happens before the DDA waiver application packet can be submitted by the CCS for regional office eligibility staff review. The next key process is the DDA waiver application packet. The DDA waiver application packet includes the Medicaid waiver application, the person-centered plan, level of care form, freedom of choice form, EDD release form. All required documents must be submitted in order to make an eligibility decision for the applied waiver program. The waiver application packet should be submitted within 2 days of the person-centered plan being approved. The next key process is approval of the waiver application packet. Regional office eligibility staff review the DDA waiver application packet. If all documents have been submitted and passes the waiver checklist, then it can be approved. The next key process is the financial eligibility determination. Upon receipt of the Medicaid waiver application, within the first 3 days, EDD will review assets, incomes, and medical expenses and apply special financial eligibility to determine if an individual is financially eligible. If an individual does not have any federal benefits, they must also be determined disabled by the state review team, or SRT, in order to be enrolled in the waiver. The next key process is the authorization to participate. The authorization to participate, or ATP form, confirms whether or not an individual meets the medical, technical, and financial eligibility criteria for enrollment in a DDA Medicaid waiver program. If the individual does not meet the eligibility requirements, they will be denied and returned to the waiting list. And the last step in the process is the overall decision form. The overall decision form can only be completed once the individual has been deemed financially eligible for the waiver. If the individual does not meet the medical, technical, and financial eligibility requirements, they will not be approved for the waiver program. Next slide, please. The LTSS Maryland DDA waiver application form includes a checklist that is associated with the various eligibility processes and requirements. This checklist is represented with the visual on the left side of the slide. As shared today, the various processes and documents can be completed concurrently, simultaneously, at the same time. The visual on the right of the slide represents the same components, but orders them differently to emphasize the importance of completed and submitting the Medicaid waiver application first so that EDD can begin their work. We will review each component on the next slides and share important reminders. Remember, individuals and families may be in crisis, transitioning from the education school system, or have been waiting for services for some time. As CCSs working with individuals and families, you are aware of their current goals and needs through your regular monitoring and follow-up activities and recent updates. Similar to expectations we would have if we had a family member in need of DDA services and supports, it is important for all of us collectively to work diligently to complete steps so that the waiver eligibility determination can be made and individuals can access services. Linda is now going to walk through each component of the DDA waiver application packet and some important reminders. Next slide, please.
Good afternoon. As we have already stated, the Medicaid waiver application must be prioritized so that EDD can begin their work as soon as possible. The CCS must prioritize creating and submitting the Medicaid waiver application within LTSS. When first contacting the individual, the CCS can begin to share the waiver application process, including what supporting financial documentation will be needed, and the application can be pre-populated with the known information prior to the initial meeting. At the initial meeting, the application can be reviewed and updates can be made. The application will then need to be signed and submitted in LTSS Maryland as soon as possible. Remember, you know these individuals and have been doing their monitoring and follow-up with them. They have shared their needs with you, and now is your time to shine. Next slide, please. As a CCS, you may be wondering, how do I know what waiver to apply for? The specific DDA waiver program that the individual can apply to is based on the program type noted within the waive. This slide includes a screenshot from the client summary section of LTSS. The bottom section, which is the DDA waiting list, future need registry, and waive information, when opened, will show you this information. In this example, the community supports waiver is noted, and that's what the CS stands for, as the applicable program for which this individual has been given the opportunity to apply. As per current guidance, children will be placed on a waive for family supports waiver. Adults that are 18 and older will be placed on a waive for community supports waiver, and adults that are 18 and older with an assessed need for residential services will be placed on the community pathways waiver. If the individual needs a different waiver program than is noted in their waive, please reach out to your regional office and share the assessed need. Next slide, please. The MA waiver application must match the waive program type noted in LTSS Maryland, as seen on the previous slide, and should have the following on the upper right-hand side of the application. We would like you to have the DDA waiver program, the CCS initials, and the date that the document was signed. This slide is an example of this requirement. Next slide, please. This is an example of the short form of the MA waiver application. Again, it must match the waive program type noted in LTSS Maryland. And in the noted area, you want to put the DDA waiver program, the CCS initials, and the date the document was signed. This is an example of that requirement. Next slide, please. The MA waiver application must then be uploaded into LTSS Maryland in the documentation section of the DDA waiver application packet. Uploading this document allows EDD to start their financial eligibility determination process. Supporting financial documents should also be uploaded in the documentation section. This slide includes a screenshot of the DDA waiver application packet enrollment checklist and documentation section where the MA waiver application was uploaded. Next slide, please. If the individual does not have all of their supporting financial documents, the CCS must submit the MA waiver application with the current available documents. It is so important to not wait until you have all of the documents. We must submit it so that EDD can begin their processes. Documents that are provided after the MA waiver application packet has been submitted shall be uploaded into the client attachment section under financial document dropdown. This slide includes a screenshot of the client attachments, new documents area of the MA waiver application where the CCS can select financial documents to upload any additional documents that are received after the DDA waiver application packet was submitted to the regional office. Next slide, please. The MA waiver application has a 6-month consideration period, which begins on the first day of the month that the application was received. For an example, an application signed on February 21st, 2024, the consideration period will begin on February 1st, 2024, and is good through July 31st of 2024. July 31st would be the end of the 6-month consideration period for an application that was submitted on February 21st. If any supporting documentation is missing, EDD will send a request for information letter with the date that the information must be returned to EDD. Applicants who do not complete within the designated timeframes will get a denial letter. If they submit the missing documentation before the end of that 6-month consideration period, the individual can still be enrolled. If they do not submit the missing information, they will have to start a new waiver packet. Next slide, please. Again, it's important to note that the applicants who do not complete everything within the designated timeframes will get a denial letter. If they submit the missing information before the end of the 6-month consideration period, they can still be enrolled in the waiver. If they do not submit the missing information before the end of that 6-month period, they will have to start a new waiver application. Next slide, please. The individual person-centered plan is a component of our DDA waiver application packet. The PCP is an outline of an individual's goals and visions for their good life. A good PCP is comprehensive and ensures that the individual's assessed needs are met through various supports so that they can achieve their goals and objectives towards their defined good life. The PCP is based on information gathered during the interview process, the assessments, and the meetings with the individuals and their team. Next slide, please. All new waiver applications must have an initial PCP. The PCP program must match the WAIV and the MA application waiver program. As the CCS is working with people and conducting regular monitoring and follow-up activities, you are already familiar with this individual and their goals and their immediate needs. The immediate service needs can be noted in the initial PCP for the waiver enrollment. The plan can be revised as needed afterwards. And as our collective goal is to support the individual into getting enrolled in the waiver and starting services in a timely fashion, it's particularly important to submit the initial PCP as soon as possible. Again, PCPs can be pre-populated based on the previous discussions and monitoring and follow-up activities. Individual PCPs can be submitted without a provider. The initial PCP is also the opportunity for the individual to pick their annual implementation date, which is like a birthday. Next slide, please. For people that are interested in self-directed service model, DDA will be offering self-directed service introduction sessions. There was a communication that went out today. Our first one will be on March 27th. This will help people further understand their roles and responsibilities to prevent delays in services. Individuals can begin to receive services under the traditional model while learning about their self-directed services. People who are currently in self-directed services can also sign up for the introduction sessions. Next, Rhonda is going to share some information related about level of care, freedom of choice, and supporting documents.
Thank you, Linda. Next slide, please. The next component of the DDA waiver application packet we want to review is the level of care form. Prior to entering the waiver program, individuals must be certified as being in need of waiver services and must meet Maryland's developmentally disabled eligibility criteria, which includes the need for active treatment. The level of care form serves as documentation that the person is medically eligible to participate in the DDA waiver application. Next slide, please. The initial level of care form can be completed prior to or after the initial meeting and immediately uploaded into the DDA waiver application packet. Please be sure to use the current initial level of care form, which is posted on the DDA website and a link included in this slide. It is important to complete all required fields in the form and for the CCS to sign the form before uploading into LTSS. Next slide, please. The freedom of choice form documents that the person has elected to receive services and supports through a DDA waiver program instead of an institution or some other entity. It also indicates that the individual understands that they can choose among service models and receive DDA waiver services from any of the approved DDA providers. It is important for the CCS to review this information with the individual so that they are adequately informed of these choices. The DDA Guide to Services, an easy read guide, is a helpful tool to share with people and families. The form includes a box noting which service model the individual is interested. Selecting a model on this form does not commit the person to the selected model. As a reminder, people can explore the self-directed service model in the new DDA self-directed service introduction session. Individuals can begin traditional services while exploring self-directed services to prevent any delays in getting their immediate needs met. Next slide, please. This slide is a reminder to use the current freedom of choice form and complete all required fields, including the person's name and required signatures. Next slide, please. The next component of the DDA waiver application packet we want to review is the EDD release form. EDD can now release information regarding the person's financial eligibility to another person. The individual must sign the form and indicate who they would like EDD to share eligibility information with. In many cases, the individual indicates that they want the CCS to receive a copy of all financial information related to eligibility so that the CCS can also receive letters and notices about the individual's eligibility status. It is important to update this form and submit to EDD when the CCS changes, especially when the person chooses a different CCS agency. The form was updated to reflect all DDA-operated waiver programs and posted on the website at the link noted on this slide. Next slide, please. Lastly, we would like to review the importance of supporting documents associated with the DDA waiver application packet. A list of required financial documents are listed on the first page of the Medicaid waiver application. As shared previously, during the initial call to the person and family, the CCS should share examples of documents that the person should begin to collect for the initial meeting. In order for EDD to make a determination, it is important that all requested documents are submitted in their entirety. For example, if a bank statement is requested and it's 10 pages long, the applicant is required to submit all 10 pages of the document. This includes if the last page is blank, it still needs to be submitted. And all information in the document must be viewable and readable. Therefore, no sections or information should be marked, redacted, or blackened out. Next slide, please. If any supporting documentation is missing, EDD will send a request for information letter with a date the information must be returned to EDD. Requested documents should be submitted to EDD as soon as possible and uploaded into LTSS Maryland client attachments under the financial documents drop-down option. Reminder, individuals who fail to submit required documents will be denied enrollment. They have up until that 6-month consideration period Linda was talking about to provide the documents before an entire new waiver application must be submitted and the process begin again. Next slide, please. This is a screenshot of the various supporting documents associated with applying for a Medicaid waiver program. We have also included links to the long and short forms so you can click on and review. Linda is now going to walk us through some scenarios. Next slide, please.
All right, now we're going to talk about a few specific scenarios. The new concurrent eligibility processes will be used for all DDA applications to support a timely waiver eligibility determination, including but not limited to our TYs, individuals in emergency or crisis situations, and individuals in institutions. This concurrent eligibility process can be used today. New process must be utilized for all of our upcoming TYs and all other individuals placed on a waive as of March 1st, 2024 and after. Our TYs will be added to the TY waive by March 1st. Some of the regions may have already started adding them, so you may start getting alerts about the TYs that have been added to the waive. Next slide, please. So first, let's talk about our TYs, as they are the largest group that we support with waiver application process each year. As per our discussion today, the MA waiver application is good for 6 months from the date that it is signed. This means that we can have the TY sign their application prior to May 15th. As TY funding becomes available on July 1st of each year, The PCP effective date should be no earlier than July 1st. If people plan to start services after July 1st of their TY year, then the date should be noted. For example, some people may take the summer off and start services in September. Please contact the regional office if you need help determining when the MA waiver packet can be submitted so that they don't lose that 6-month consideration period. Next slide, please. This slide relates to individuals that are in crisis or emergency situations. Their health and safety are in jeopardy, so we don't have time to delay. Ask yourself, what supports and timeline would you want if you or a family member were in this situation? The individuals in these situations should be fast-tracked and processed as soon as possible. You already know this individual and this situation. You've submitted the PCA to the regional office. You've submitted the emergency request. So you know the individuals and the situations. You need to immediately reach out and contact the individual upon the receipt of the alert that they have been placed on the waive. Complete the DDA waiver application packet as soon as possible. Pre-populate everything you can ahead of time. The packet should be submitted within 3 days. This can be done as you already know these situations. Please reach out to the regional office for assistance if you have any problems processing or identifying providers. Next slide, please. Individuals that are transitioning from institutions, nursing home facilities, Holly Center, Potomac Center, a behavioral health hospital. The MA waiver application may result in an advisory opinion whenever housing or a transition date has not yet been determined. When a date has been determined, then an ATP authorization will be completed and the individual will be able to transition. Next slide, please. It is very important that you contact the regional office and alert them of the transition date once housing is confirmed and the discharge date is set. This way that we can submit those authorization requests to EDD and they can discharge on the date that they need to. The advisory opinion is good for a specific amount of time, which is noted in their letter. If housing is not identified by the date of that end of that letter, then a new waiver application must be submitted and the process will begin again for another waiver advisory. On the day of the transition, it's very important to confirm that the individual was discharged. If the individual does not get discharged on that transition date, you have to immediately contact the regional office and share the new discharge date. Next slide, please. This slide relates to people being referred to another DDA Medicaid waiver program. So individuals who are currently enrolled in a DDA Medicaid waiver program, but have a new service need that cannot be met in that current program, or they're aging out of the FSW waiver, need to be referred to another waiver program. To be referred, the CCS must complete the initial PCP for a new Medicaid waiver program. Once it's approved by the DDA, the CCS will then complete the MA waiver application and continue with our new concurrent eligibility process. We've included a link to the related policy as a reference. Next slide, please.
Linda?
Rhonda's now going to talk a little bit about our state review team process.
Thank you, Linda. So as Linda mentioned, we're now going to talk a little bit about the state review team process. People without a federally determined disability will be referred to the state review team for a determination. If a person over the age of 18 and does not have a Social Security, they will most likely be referred to the state review team process. CCSs can share the state review team forms with the person and their teams so that they can complete and submit these forms to EDD as soon as possible. The state review team forms can be accessed at the link on this slide. Next slide, please. This slide relates to income and assets. As part of the financial eligibility process, EDD will review the individual's income and assets to see if they are within the federally approved waiver program standards. Income and assets are based on the applicant's information only, the applicant's finances only. Some people, even current waiver participants, may have monthly income and assets that can put them at risk of meeting or continuing to meet the financial eligibility requirements. To support initial eligibility and continued enrollment, CCSs should continue to share information regarding the option to establish Maryland ABLE accounts and special need trusts and other strategies which provide some protections under the Medicaid rules. We have included a link to the Maryland ABLE website on this slide. Next slide, please. This slide is a high-level visual of the old process and the new concurrent process. It demonstrates the steps in the processes that have changed. They're reflected by the white tiles. Reminder that the requirements have not changed. A few items in the process have been moved around to allow EDD to start their work as soon as possible to support timely eligibility determinations and access to services. The CCS should prioritize creating and submitting the Medicaid waiver application first. The CCS should concurrently complete the various LTSS Maryland DDA waiver application packet processes, such as the person-centered plan, level of care, freedom of choice, and the EDD release form. Next slide, please. This slide highlights the documents that are in the DDA waiver application packet. As shared in previous slides, the various processes and documents can be completed concurrently, simultaneously, at the same time. Here are a few highlights to remember. All documents can be pre-populated before the initial meeting. Remember, you know these people and you have been working with them for some time now. The Medicaid waiver application, that's the short or long form, should be submitted within 3 days from the date of the waive placement when you get that alert. The PCP should be submitted within 10 days from the date of the waive placement. Use updated level of care, freedom of choice, and EDD release forms in the LTSS Maryland. Please feel free to print out this slide and other slides as desk reference tools. Next slide, please. This slide includes some redetermination reminders. CCS should be on the lookout for redetermination letters. The letters will note where to submit the application and supporting documentation. The letters will note whether it needs to go to EDD or the local Department of Social Services. CCSs need to upload documents into the client attachment section. The redetermination application should be uploaded under the MA application drop-down option and supporting documents under financial documents drop-down. Similar to MA waiver applications, in order for EDD or the local DSS to make a determination, it is important that all requested documents are submitted in their entirety. Please note that if you upload documents into LTSS Maryland that need to be submitted to the local DSS will not receive them. You need to make sure these are submitted directly to the local Department of Social Service if they're indicated as the point of contact in that redetermination letter. Next slide, please. Individuals are sent 4 letters before they're disenrolled. If an individual does not meet the timeline or requirements, please advise them of their right to appeal this disenrollment. If appealed timely, within 10 days of the notice, their services can continue if they're enrolled in the program until the appeal decision has been given. Note if the individual has up to 120 days to submit documents to be reinstated without having to fully reapply. Next slide, please. This slide includes links to helpful tools and resources you can use. It includes the MA waiver application, both the short and long form and the redetermination form. It includes information related to the various programs, financial eligibility determination updates, and our guide to service, and the new EDD release form. Next slide, please. This slide includes the contact information for your regional offices. Please feel free to reach out to them for any questions and technical assistance. Next slide, please. And now we'll take some Q&A. So we've got a few questions here, a few more coming in. We've got a couple questions, Linda, related to what happens if the waiver packet cannot be submitted within the first 3 days of being added to the waive? There are times that it takes longer than this to schedule a meeting in order to obtain the signature on the waiver application. Can you share a little bit about that in terms of our targeted timeframes and understanding at times there's some extenuating circumstances that may need to be considered?
Yes, so we understand that not everybody's going to be able to meet with you in that 3-day time frame, but being that we want to make sure people have timely access to their needed services, we're asking that you strive to meet that 3-day timeline. We do understand that there are things that pop up. Some folks end up in the hospital or families are away on vacation when their waive comes through. So we do understand that. Just reach out and work with your regional office so that they can help you track that and make sure that gets in as quickly as possible so we can get folks timely access to service.
Thank you, Linda. There's another comment in here related to what happens if a CCS takes a week's vacation and their client is put on a waive in that situation. So Linda, is it your understanding that when CCSs are on vacation that there is to be a supervisor or a backup to support the people they support?
Yes, it is my understanding that whenever a CCS goes on vacation or has a leave, that there is another CCS that's assigned to cover their caseload, or the supervisor would be covering their caseload so that we can continue to move forward with getting folks into service quickly.
Thank you, Linda. The next question is, in regards to the documents signed, do they all have to have the same dates as before in the procedure? Do you want me to take that one?
Sure.
Sure. So no, the documents do not have to have the same dates. So remember, you're going to do that MA waiver application first within the first 3 days. You get that signed, you're going to get that into LTSS and upload it in the waiver application packet so EDD can start their work. Then you're working next on that PCP. So that signature date for the PCP will be after the MA application date that's being signed. So the dates do not have to align anymore. You want to get those signatures as they're completed and work on these concurrently as best you can to get them in. The next question or comment is with the TYs being put on the waive March 1st or sooner, then we would be expecting to see the waiver applications, the MA waiver applications be submitted soon after, like March 4th. Yes, that is true. We're looking for them to be submitted so EDD can start their process. And so we are on the lookout for those, and we'll be continuing to support technical assistance as needed and monitoring the MA applications coming in. The next comment or question is if the waive alert recommends the short form, but the individual has not applied for SSI, should a long form be completed instead? I would say if the person does not have Medicaid medical assistance, then that would make sense to me. I would follow what the alert that you get in the system. And if EDD needs additional information, they will reach out to you. The next question says, the freedom of choice form seems to assume that the person is going to choose waiver services. What happens if an individual indicates on the form that they choose to receive services in an institution? I know that's going into an institution is discouraged nowadays, but it doesn't seem to be an actual choice that is theoretically available and a need for an institutional level of care. People absolutely have the choice when applying to a Medicaid waiver program to choose an institution over home and community-based services. That is some of the core parts of the home and community-based services under the Medicaid programs. Just scrolling down to some additional questions. To confirm, Linda, if a person is a TY and added to a waive as community pathways program, does the initial PCP have to match the program as community pathways? What if the person does not want residential services? Should it be community supports for the initial plan? Can you talk about what the CCS should do if the person does not need residential services?
Yes, so most TYs are going to be added to the community supports or the community supports waiver. However, if somebody has been added to the community pathways waiver because it was somewhere identified that they would need residential services and then they choose not to have residential services, please reach out to your regional office so that they can update that waive to put them onto the correct waiver program.
Thank you, Linda. The next one is, again, so all dates no longer need to match on all documents in the packet. Correct. All dates do not need to match. The next question is, how does the approved waiver packet get from DDA to EDD? Who sends and how? This is all done within LTSS Maryland. The DDA waiver application packet is created and submitted by the CCS. It goes to EDA, we review it, and then from there, an ATP would be completed after all the determinations are made. Is Social Security income required for all waivered plans? No, what we were talking about was identifying, flagging that if a person does not have medical assistance, Medicaid, or Social Security income, and they're over the age of 18, they will most likely have to go through the state review team process to be determined disabled under the federal standards. Someone's noting they have a late TY. Do they still use the new process? I'm not sure what a late TY means. I would suggest you reach out to the regional office to walk through that specific situation. Is a waiver meeting and in turn waiver meeting minutes still required as part of the DDA waiver process? Yes, when you conduct that first meeting and you're getting that MA waiver application completed, that would be considered the waiver meeting. We want you to continue to do the minutes and submit that information. Will we get notification when the person is added to the waive? Yes, you get an alert in LTSS. The CCS that is assigned will get that. If a person is in a nursing facility for long-term care, but they want to return to the community-based service. Is it possible to return to the community-based services, and is AIRS assessment required? AIRS assessment is not required under our service delivery system. That is required for other programs. People in nursing facilities and long-term care facilities can be supported in transitioning out or returning back to their community under the DDA waiver programs. We would also be working with the Money Follows the Person's teams. Just reviewing some of this, timelines for DDA reviewers to review initial PCPs and applications in LTSS. Yes, we've met with our teams and we will be reviewing PCPs within a 10-day time frame. So the dates in the application, initial level care and freedom of choice is no longer the date. Correct, the dates should be the dates that these forms are completed and signed. Person noting, Linda, that they were not aware that they should assist with the state review team forms when this is completed, and where do we upload them? Can you talk a little bit about the state review team process and forms and what support the CCSs should be providing?
Yes, so if you have received the notification that there is a request for more information letter, a lot of times it will be related to a state review team. In this PowerPoint, you will have a link to those state review team documents. If the family does not receive them timely in the mail, you can assist them with getting those completed and filled out and submitted back to the appropriate source.
Thank you, Linda. We're going to go through a few more questions, so if you want to hang on with us, that would be great. When asking to pre-populate information on the MA application, how would we know whether to fill out the short or long form if it's usually is told to us when they are added to the waive? Remember, when a person is added to the waive, that's your first alert. That's your first notification that you can help somebody apply to the waiver. That alert will include the waiver program that they can apply to. And in our example in our slide was community supports. And you will also be alerted to whether the short or long form is needed. So you'll get that all at the same time. And then based on that information, you'll be able to know whether to pre-populate the long or the short form. Question about if a person gets an SSI approval letter and back payments of that, you'll want to work with, the person can work with a benefits counselor related to that. I know of a person who recently had that. It does not make them ineligible because there is a grace period due to the back pay for the person to be able to spend that information, but that would need to be reviewed by the benefits counselor, and EDD would also be considering that. In the future, will the waive be the same date every year? Example 3/1, so we can have more of a heads up of when the waive is coming. It will not be necessarily the same day every year. We'll probably start a little bit earlier next year for the TYs at least. What happens if the families that were recently assigned to takes up to 6 months for the MA waiver application approval? If the family members are not being responsive, reach out to the regional office. We can look at supporting you in those efforts to make sure that they still have an assessed need. Can we do the waiver application meeting virtual? Yes. If an individual is DDA state funded but needs to be enrolled in a DDA waiver, will they be added to the waive by the regional office automatically, or do we need to contact a regional office to ask that it be completed so that we can start the waiver application? Reach out and coordinate with your regional office. All state funded people that are DDA eligible should be supported in completing a waiver application packet and getting re-enrolled into the waiver programs. Next question, what happens if a CCS cannot locate a traditional service provider for a TY? Do they switch them to self-direction? Absolutely not. CCSs do not make those choices and decision to do that. As we talked about today, initial PCP can be submitted without a provider and the person can continue to explore the providers. You do not have the authority to change models. If you need assistance in finding a provider, reach out to your regional office. Scrolling down to see some other. If a person's turning 21 in September, would the person be considered TY 24 or 25? There's a lot to consider related to that question in terms of turning 21. So really, if they're a TY, you will get alert on the wave. The regional offices will vet all potential TYs and put them on the wave. If you have specific question about a person, reach out to your regional office. Will the recording be available to access and refer to later? Yes, it will. Does the alert tell us which MA form to complete, long or short? Yes, you will get alert to tell you which form to complete. Where do we submit the Medicaid application and LTSS for EDD to review within the first 3 days? In the DDA waiver application packet, it includes that checklist of items that need to be completed. You will upload the MA waiver application, the short or long form, into the DDA waiver application packet. When you upload it, it automatically gives an alert to EDD so that they'll be aware of that. Remember, Linda shared with us today, you want to upload all supporting documentation that you have at that time, but do not hold the MA waiver application to get additional documents. Upload it. As you get additional ones, you can add it to the packet until it's the packet submitted, and then after that, you can add it under client attachments. Will we get a copy of the slides? Since the handout does not seem to have the working link. Sorry if the link's not working. Yes, you'll get a copy of the slides. If you get the DDA newsletter that was sent out today, it includes a link to the slides. Person noting that someone was in residential services fell out of the waiver, please work with your regional office. They can answer your questions directly. Question about resources for special needs trust. Are there any resources for families seeking this? There are various resources related to special needs trust and law firms that set them up specifically. So that would be something the person would need to refer and research. Question, if a TY was not added to the waive by March 1st, do we reach out to the regional office? Yes. Can a person apply to SSA or SSI Medicaid prior to being added to a waive? Yes. All individuals who are on the waiting list or seeking services should be encouraged and supported to apply for medical assistance, Medicaid, and SSI when they turn 18. Do not wait until they get added to a waive. If they get that medical assistance and SSI determination prior to being a TY and added to the waive, that means they won't have to do the state review team process. Question, if someone was denied SSI, would you help with the state review team process? Yes, I would say help them with that. Asking if we could provide the date of the self-directed training session, information session. Linda, that's March 27th, I believe. Is that correct?
Yes, the first one is March 27th. The DDA communication that went out earlier today also has additional dates in the future.
Yeah. That information was also noted in our newsletter. Someone is asking how we get that information. So it was noted in the newsletter that went out this morning. Just reviewing, some of these are duplicate. Couple questions about person centers plan. notes that if you receive notification that the plan is approved, but when you look on the system, it remains in an inactive status. Linda, can you talk about the PCP being approved, but remaining in an inactive status until the waiver enrollment?
Sure. So the approval of the PCP is DDA approving the services that were requested to support the person's need. The PCP does not become active until the waiver is approved. And that is done by EDD when the overall decision form is completed. At that point, then the PCP will become active and the individual can start services.
Question to confirm that TYs will be added to the waive by March 1st. Yes, that is correct. Question, the new concurrent processes will go into effect on which date? They can begin today. You can start to use this process today, but they will go into effect for everything March 1st. A couple people are meeting with people soon, asking about the PowerPoints that was included in the newsletter, and we'll ask Donna to send them out to all registered guests since the link's not working. Question about just hearing about the process. Their TY was added 3 days ago, so please just start to work with them now. We're looking at the questions about days. We're looking at business days for three business days for the application to be completed and uploaded, and 10 business days for the person-centered plan, that initial plan. Question, what if someone is over asset at the MA application time frame? Should we wait until they are below and submit knowing that it will be denied? Do not hold any MA waiver applications. We do not, and you should not make any determination about whether someone is over income or over asset. There are various financial eligibility categories under the waiver programs, and EDD can also utilize medical expenses to kind of spend down some of that. So it's important that we don't make those determinations and we let people who are knowledgeable and trained in the financial eligibility. So I'm going to take a couple more and then we'll close for today. Appreciate you guys hanging on. Questions about SSI payments being denied again. We want to support people with their options, the ABLE, the special needs trust. Do not hold the application if they provided the opportunity to apply, so that we can make that determination, even if it's unfortunately to be denied. Couple questions about, I'm checking for the newsletter, but I do not have it. If you're signed up on the DDA communications, then you would have gotten the newsletter. It went out this morning. And again, we will be sure to send out the presentation after the webinar so that we make sure you get them, since the link was not working. The newsletter also will be posted on the DDA website under what's new. All the newsletters are posted there, so you can kind of refer back to them. So in kind of reviewing and closing, today we talked about the waiver application packet and process. And so all the components are the same. We're just doing them in a little bit different order, and we're doing them concurrently. So it's really important that once someone is put on a waive and the CCS gets that alert, that you're immediately taking action to get that MA application pre-populated, reaching out to the person, letting them know in that initial call that you're going to be meeting, setting up that meeting as soon as possible, letting them know about the financial documents, bank statements and such that they should start to gather now, that you'll be reviewing the MA application and talking about their PCP based on goals and needs that you guys have already been talking about. Because remember, you've been working with these people, you know their needs, you've been monitoring and follow up and have updates related to them. So you'll be able to take action. Collectively, our goal is to prioritize our work so that we can support people in this process and get timely eligibility determination so they can access services. Remember, if this was you or your family member, what actions you would want to be taken in due diligence to support that. So we appreciate you joining us today. We will be posting the webinar recorded after we complete the last one next week. Feel free to join us if you'd like to review information again. Sorry that the link was not working. We'll make sure you get the presentations, and we look forward to talking to you soon. Thank you so much for all your support of people and families. And if you have person-specific or additional questions, please reach out to your regional office. Thank you. Have a great day.